Just a quick reminder, this podcast is general information only and doesn't replace medical advice. Always speak with your treating team to know what's right for you.
And it's so helpful as clinicians for us to tailor a treatment that is going to be more fitting for one's lifestyle. And we want to know that. We want to know whether you're scared of needles or whether you have a hectic work schedule where you don't want to be taking tablets all the time. So all these sort of things, these other extra factors that really help us kind of tailor and offer a treatment that's right for you.
Welcome to Beyond the Count. I'm the founder and CEO of ITP Australia and New Zealand and your host, Danielle Boyle. This is a space created for the ITP community by the ITP community, where we share real stories, expert insights, and everything in between. Whether you're living with immune thrombocytopenia, supporting someone who is, or just trying to understand what life looks like beyond the bruises and the blood tests, you're in the right place. Today, you're listening to our 4-part series on Decoding Risk, designed to help you make sense of ITP treatments, side effects, and the information that can sometimes feel overwhelming. If you've ever read the side effects list and felt your stomach drop or wondered, how do I even know what's normal and what's not, you're not alone. Across this series, I'm joined by Dr Danny Hsu, consultant haematologist and medical advisor to ITP Australia and New Zealand. And we're breaking it down in a way that's clear, practical and reassuring. So whether you're driving, out for a walk, folding the laundry, or just sitting back and tuning in, let's dive in and go beyond the count together. In today's episode of our Decoding Risk series, we're bringing everything together because understanding risk is one thing, but knowing how to actually have those conversations, ask the right questions, and feel confident in the decisions that you're making, that's where all of this really matters. In this final episode of the series, we're talking about becoming a partner in your care. Dr Danny Hsu and I explore what shared decision-making really looks like in practice, the different ways patients engage with information, and why there is no right way to be a patient. We talk about how to communicate what matters to you, how to ask the questions that help you make informed decisions, and what to do if you don't feel heard in your care. Because at the end of the day, this is your health, your life and your journey. And you deserve to feel informed, supported and confident in the path that you choose. Let's get into it. We'd like to welcome Danny Hsu back for the 4th and final episode of Decoding Risk series. And today we're going to be talking about becoming a partner in your care, an SDM. Thanks, Danny, for joining us.
Oh, thank you for having me again. Here we are at the climax.
It is. And this is probably one of the most important parts of this series and the conversation, I suppose, around living with ITP is, being a partner in the decisions and having the open conversations. And I know that every single episode that we've recorded, we've touched on this, and this episode is going to be 100% dedicated to this. So sort of a bit of a flashback. This presentation and this series came off the back of the presentations that you did at the 2026 Patient Conference in Melbourne, which was exceptional. But there was so much information in that presentation that I thought it was really important that we broke it down into a few bite-sized pieces, hence the reason why we're doing this particular series. And throughout that entire presentation, Danny is the king of the analogy, and so many analogies, and it's so amazingly relatable. One of the things when it came to being a partner in your care and really advocating for yourself as a patient is that there are a couple of different patient styles, right? You talked about in the presentation the sticky beak and the she'll be right mate kind of patient. Can you explain what each of these are?
Yeah, absolutely. And I think with most patients, but once sort of initial shock of the diagnosis and things start settling down, there are probably two very general, I think, I guess, type of patients. And sticky, I call one my label was a sticky beak, although that's probably a little bit more derogatory potentially in nature than I wanted to do. But really, it is a patient that really wants details. They really want everything there is to know in terms of what are treatment options, the side effects, the incidence, the severity, and that's perfectly and absolutely fine. And then on the other end of the spectrum, I have patients super just do not want to hear about detail. They just want to go for the ride. And really, I think what they really want, they probably want to avoid any negative information, potentially, because it absolutely can cause anxiety. And maybe they just have all the faith in their clinician in making, I guess, the best or the right decision for them. Not right, but the best decision for them.
Yeah.
And I think they're both completely kind of valid styles to adopt. And really very important as clinicians, we need to adapt to that. We need to kind of tailor our relationship, our consultations with our patients, just depending on how much do they want to know. Do I want the details, or do I want me to be much more selective in terms of what to convey? And I think this is that very important, I think, step in that therapeutic relationship for us to establish and know what sort of patient style in terms of when we want to convey the information.
And I think too, from a patient perspective, you did definitely touch on it. I know when I was first diagnosed, I was she'll be right. Like, it'll be fine. I'm really not that sick. And I had that level of innate trust in my clinician. Yeah. Yes. I had, Dr. Rob Bird as my clinician. So he was, at the time, Australia's leading ITP clinician. But not everyone is as lucky as what I am. So we just patients make an assumption, okay, this person in front of me knows everything about this particular disease. So that also can be part of the she'll be right sort of mentality. And just because she'll be right today doesn't mean that you won't end up being the patient that wants to know all of the information in the future. So I've done the full 360. I'm like the other end of the spectrum now. Yeah. But I think that it's really important from a patient perspective to remember that, like you said, it's very valid to be either one or the other or a mixture of both. But knowing how to communicate that to your clinician is also really important, because if you're sitting there and you're not really opening up, you guys don't really know you guys might go, okay, well, they're a she'll be right kind of patient, but maybe they've got a million things running through their mind. And with a whole lot of questions that they want to ask, but feel like they're going to get rushed out the door and next.
No, I think you touch on such an important point, my dear. As a clinician, I'm very mindful of that, of trying to create the space and the kind of environment and to give the time, I think, to patients to really become an active partner in their care, for them to allow them to be able to ask questions. They might think, oh my gosh, that's a silly question, or and then they might not want to ask it, but to really give them an opportunity to ask. And I guess what I learned is that you don't do it in that one long consultation, right? So you could always come back for more, particularly when it can be quite overwhelming when you get first diagnosed and you're still battling from the side effects of Satan's Tic Tacs on steroids. You might just not be ready at that particular time point to sort of absorb some information. And so I've learned to try to space it out and to give as much information I think is being absorbed, give opportunity for patients to ask questions, and really that's how I figure out, okay, what sort of information style they prefer. Do they want to detail things, or right now maybe they want to be in that she'll be right sort of phase where I don't want to inundate them too much, but I might later on talk about that as we wean off the steroids and talk about the sort of other aspects of the disease. So so it's important to be an active partner, be able to verbalize. And if you can't do that, I think what's really been effective in some of my patients is they've asked their loved ones or carers to do so for them, right? And that's completely fine. That's completely fine.
And because I suppose that support person, that second set of ears may pick up other elements that you may not have picked up during the consultation.
Yeah, absolutely.
And they don't have the same emotional attachment to the disease, the treatments, as what you do. And those elements are valid from a patient perspective, but as you're absorbing that information and absorbing, that knowledge, you're only going to absorb as much as you can and certain tidbits. And if one of your silly questions that you think a silly question is, can you spell that for me? That is not a silly question.
No,
the amount of times that I had Rob write down on a piece of paper how to spell this particular treatment, or what do you mean that this has happened? And he'll draws little he used to draw little diagrams and everything for me as well. I think that's really important. And as a clinician, I know that you do this exceptionally well. Is that you have that open and inviting space to be able to, provide that for patients as well.
And Danny, you made such a great point about having that support person there, because you literally see patients sitting there sort of processing as you're telling them something. And obviously they're dealing with the emotional aspects and the reaction to that, right? The psychological aspects of that. But to have them, their loved one, their friend, whoever it is, to then be able to sort of, in a way, process that kind of immediately and then think, okay, and ask a objective sort of type of question that at that moment the patient in a way is not ready to ask yet. It's incredibly helpful. I think it's incredibly helpful for everybody.
Yeah, and I think too, we also take for granted that you guys use a lot of terminology and a lot of lingo and those sorts of things. And I remember advocating for somebody else outside of the ITP space. It was at a completely different time, and a doctor walked in and said, "Oh, your such and such results are 20." And the whole room went silent, and I went, "But what does that mean?" Can you give, in plain speak, can you actually, as that support person, can you explain that to me? Because I have no idea what that means. That could be fabulous, or that could be really, really bad, or it could be somewhere in between. So explain that to me and really nut it down. So talking about asking questions and, what are the 3 questions that you think that every patient should ask their clinician?
Yeah, so really, I think when it comes to, most of the questions we have obviously going to be around our treatments. And really, I think there's 3 key questions. Is number 1, what are my options? Right? Number 1, I think that's very important. Is it an alternative to steroids, or whatever it may be? And of course, following that, very importantly, well, what are the pros and cons of each option for me? And the third one, for just as important, is, well, how do I get support to help me make a decision that's right for me? That might be in the form of maybe written information, or really, for me these days, it's very easy. I say go to ITP Australia website. So that's really the answer everyone should give. But also would be speaking to your GP, speaking potentially another trusted specialist that they might have for their other sort of comorbid conditions. So these are the three main questions that, for everyone to think about and to verbalize, I think, when it comes to, treatment options.
I think you're 100% right there. And asking those questions, if you're not happy with the answers to those questions, and we have had many patients over the years, what are my treatment options? Well, it's this, or you can find another haematologist. That's not the answer. That's not okay. And it might be valid to go and get a second opinion. Remembering though that a second opinion doesn't mean that you're leaving your clinician. A second opinion doesn't mean that you don't believe your clinician. It's just you want a fresh set of eyes on what's happening, and they might see something else. I personally had a second opinion before my splenectomy with Phil, and after and Rob was like, I'll definitely set it up, and there was no animosity. Like, he didn't take it as an attack. which was good because, I felt a little bit guilty as a patient going, do you mind if I talk to somebody else about this? But we have to remember is that as a patient, you live with this disease every single day.
Yeah.
It's your prerogative. It's your health.
Yeah.
You're the one that's got to live with this. So seeking a second opinion isn't a problem. And so if you're not getting the answers that you think that you should to these questions, they're not, not helpful. I suppose if the answers aren't helpful and it's not conversational based and based off the shared decision-making toolkit, I strongly recommend getting a second opinion. And, we would point you in the direction of Danny here or, Phil Choi or one of the other amazing clinicians in Australia and in New Zealand to speak to get another set of eyes over it.
Yeah, absolutely. And look, I think the key is, to really speak up when sort of you're not understanding what meant to be saying. So I think that's really important, what Danny's point, right, about the medical jargon, because I think, a lot of us just sort of, we forget to switch and we start speaking, blabbing away, talking about stupid words that,
megakaryocyte and platelets and, thrombopoietin and, you sort of go,
exactly.
What?
Yeah, exactly. So it's really important, like, when you are hearing these words, you don't understand, but please just put your hand up and say, hey, I'm so sorry. I don't actually, what does that actually mean?
Yeah.
And I think you touched on something very important before about, the clinicians spitting out numbers. I'm guilty of that too, going, hey, your platelets are now blah. What's a normal bloody range, right? You could always ask for information to be presented in a different way. And I've learned this now to actually never just give the number. I always have a graph of the patient's platelets on screen and say, look, see that green range? That's where it's supposed to be, and this is where you are. But then again, explain again what's a safe versus a normal range. I think is very important. But we could always present the information a different way to make it a bit more, easily absorbed. Hence why I love analogy so much, Danny, because I think I've learned that it is a very, very good way of bypassing all that misunderstanding when I'm using jargon, when I'm trying to explain, the pathology of ITP. That's very complicated, but using analogies, I think that's so helpful.
I do the same as well. Satan's Tic Tacs.
Yeah,
like it's like I use that for corticosteroids all the time. Like it's thank you.
Yeah.
Thanks to our sponsor Takeda for their ongoing support of ITP Australia and New Zealand and our podcast Beyond the Count.
Flashback to Patient Conference 2025 in Sydney. We're going to take a leap back in time to, again, your presentation on shared decision-making, where you came up with an amazing analogy for shared decision-making. We talk about shared decision-making or SDM, depending on where you see it and where you read it, finding the right dance partner. What should patients do if they don't feel like they're being heard?
Yep. No, thank you for this great question. And look, this analogy of finding the right dance partner came upon me because I was writing that talk and I was into the music, of course. And then the imagery of, these two people dancing together just sort of propped up. And I thought, geez, that's exactly what therapeutic relationships are. When you first, meet your clinician, you're there trying to find who's going to lead, what dance are we going to do, and then you might step on each other's toe for a wee bit until you get a bit more comfortable. And I guess, you're there as a patient trying to find the right dance partner for what's going to be potentially a long dance. And it's okay, and I think those of us who've taken dance lessons before would know that sometimes you feel, oh, nope, I need to change partners. We both just keep stomping on each other, and there's no issues at all for you to go, you know what, I'm going to just go dance with that other person to see whether there might be a better dance partner for me. So it's absolutely okay to change clinicians because really this is something that's so important, right? I mean, this chronic condition that patients are living with, you really want a partner that you feel comfortable with, that you're not clashing, and that you can be open with, and that you feel comfortable with and able to openly communicate with. So I think that's really important. You deserve a long-term partner in your care, someone that you feel comfortable with. So by all means, if you feel like you're not being heard or the conversations are not really as open as you would like, it might be a case of you just need to find a different dance partner.
Yeah. And I think that's so it works really, really well. There's no point, dancing with somebody that's doing the waltz if you want to do a foxtrot, right?
Yep.
For younger patients out there, that's the ye olden day dances. You're not going to see those on TikTok. But it's really important that you feel really comfortable and open to be able to share, share conversations and share the things that are really important with you. But I think the other thing to remember is that having that long-term dance partner and having that long-term relationship isn't, then your clinician, your healthcare team will understand what is your normal.
Yep. Absolutely.
Because your normal compared to the grade of, what we're told is normal can potentially be two different things. So understanding what is your normal and what's outside of your normal. So if you're on the roller coaster and, you're up and down and and your clinician can help you go, okay, we know that this isn't right. These are some of the next steps and let's have that discussion. And talking, we touched on it a couple of episodes ago about having those hard conversations. If you've got a really good relationship, having those hard conversations aren't as hard.
No, absolutely. Yeah, and I certainly learned so much from my patients, dancing with them all these years ago. You're right. I mean, they're so, in a way, they become, I feel like they can become more in tune with their symptoms, and they'll be able to tell me that, oh my gosh, I'm feeling tired again. I think my platelets have dropped, and they'll be spot on. You learn things to watch out for in other patients. Then, when you have that very open and close relationship. So, I've been very blessed to have great therapeutic relationships with my patients out there.
You are definitely an expert dance partner, multi talented dance floor partner, definitely across the board. Can highly rate Danny on the dance floor. But I think it's really important that shared decision making is extremely important, especially when it comes to ITP, because if you're sharing, say to your clinician, in 9 months' time, I want to make sure that I can travel to X, or my daughter is going to have her first child, my first grandchild. You need, sometimes those things take planning. And if you don't have that open conversation, that dialogue, that relationship, it's not going to be as open and as flowing. And, you could potentially not achieve what you want to achieve. And I think that's really important.
Yeah. No, and it's so helpful as clinicians for us to try to tailor a treatment, right, that is going to be more fitting for one's lifestyle. And we want to know that. We want to know whether you're scared of needles, or whether you have a hectic work schedule where you don't want to be on a weekly injection at home, or you might be a frequent traveler where you don't want to be taking tablets all the time. So all these sort of things are these other extra factors that really help us kind of tailor and offer a treatment that's right for you, for the patient. So yeah, communication.
Yeah, definitely communication.
And SDM.
Yep, SDM is so important, so amazingly important. Yeah. Now, I've got a challenge for you.
Uh-oh, here we go. Yeah. Okay. Yep.
I want you to, in the next couple of weeks, ask your patients, have your goals changed?
That's a great...
And I think that we need to remember that these things change from time to time as well. Yep. So we talk about shared decision making, we talk about, setting goals, and I think an extremely small portion of patients actually have goals around treatment that are communicated and verbalised. But I think that it's important that we bring it up on a very regular basis to see, has anything changed?
That is a great point, Danny, to make.
That's my challenge to you and all of our healthcare professionals out there.
Challenge accepted.
Wonderful, wonderful. Well, Danny, again, thank you so much for dedicating so much time to ITP ANZ, but also to recording this series with us, and even just doing the presentation in the first place for the patient conference in Melbourne earlier this year. Thank you so much. You'll always be a valued partner and player in the ITP space. Thank you, Danny. Look, as always, thank you for really your amazing, unbridled enthusiasm and passion and advocacy for ITP patients. It's great work that you're doing. You're inspiring. So that's why we're more than happy to be here to help anytime. Anytime. I will definitely rope you in for a couple more episodes before the end of the year. Don't you worry about that. And, listeners, if you've got any particular topics that you want Danny to, do an episode on, feel free to reach out to us at itpanz.org.au. Thank you so much, Danny, again. And I look forward to speaking to you shortly. Absolutely. Till the next podcast. Thank you, Danny. Cheers. Thank you. No worries. Bye. I hope you all got a lot out of today's episode. Before we wrap up, here are 4 key takeaways from our conversation with Danny. Number 1, there is no right way to be a patient. Whether you want all of the detail or prefer a high-level overview, both approaches are completely valid. The key is understanding what works for you and communicating that to your treating team. Number 2, when discussing treatment options, focus on 3 things. What are my options? What are the pros and cons? And how do I get support to make the decision that is right for me? Number 3, bring someone with you when you need support. A support person can help you process information and give you a clear understanding of what's been discussed when you leave your appointment. Number 4, speak up or seek a better fit if you need to. If you don't feel heard, it's okay to ask more questions, request that things be explained differently, or even seek a second opinion. You deserve a care team that listens and works with you. A big thank you to Dr Danny Hsu for joining us for this Decoding Risk series and for explaining complex topics in a way that feels clear, calming, and genuinely reassuring for our community. Thank you for joining us for this episode of the Decoding Risk series. If you've been following along, the other episodes in the series include why side effects happen, why medication leaflets look terrifying, and the words that trick our brains. If you'd like to watch Danny's presentation from the 2026 ITP Australia and New Zealand Patient Conference in Melbourne, you can find it on our YouTube channel. Just search ITP ANZ. If you're looking for support, join the ITP community at itpanz.org.au. While you're there, check out the latest edition of The Count, our quarterly magazine, read some patient stories, download a huge range of treatment information and guidelines and more in our patients section, and know that you are not alone. We're here to support you, we're here to guide you and keep you informed of the latest information when it comes to immune thrombocytopenia. If you found this episode helpful, please share it with others in the ITP community. And don't forget to leave a review on the platform that you're listening from. It helps others find the Beyond the Count podcast. We've got more exciting conversations coming up really soon. So don't forget to hit the follow or subscribe button and stay updated. And thanks for tuning in and diving beyond the count with us.